Hello, everyone. Welcome. We're working on getting everyone connected here and we'll begin shortly. We have got a big amount of information for you today, so we are going to move through the intro quickly once we get started. So give just a little bit here for everyone to get connected, and then we'll be on our way. Okay. Looks like we have stabilized here a little bit on people joining us, so we're going to go ahead and get started. Hello and welcome to South Dakota Project Firstline office hours. Today is February 12th, and we are going to cover prenatal infection prevention. Here's the team, and again, like I said, we have a lot of information we're going to cover today, so I will progress through this for today, but there are your team's smiling, happy faces. Reminders for today, feel free to submit any questions or comments you have. We encourage you to share. The recording will be shared after the event on the South Dakota Project Firstline website. And please, please, please complete that survey at the end. We really appreciate your feedback. Today's objectives. We're going to understand common prenatal infections, recognize the importance of vaccination in pregnancy, implement effective screening practices, adopt safe behaviors for infection prevention, engage healthcare providers in infection prevention, and utilize resources for awareness and advocacy. With that, I'm going to let Mindy take it from here.
Hello, everybody, and welcome. So we are going to touch base on prenatal infections, and February marks International Prenatal Infection Prevention Month. And this month is dedicated to raising awareness of common prenatal infection risk and preventive measures. So what is a prenatal infection? Those are infections that can occur when bacteria, viruses, or parasites are transmitted from the mother to the baby. Some common consequences of prenatal infections can lead to preterm birth, low birth weight, developmental delays, or serious health conditions in newborns. Some examples of these infections would be Group B streptococcus, cytomegalovirus, listeriosis, syphilis, and influenza. Next slide, please.
I'm going to pop in for just a second. I know last time we had some technical issues, but could you in the audience just let me know, can you see the screen that I'm sharing and everything looks okay on your end? If someone would kindly chime in for me, please. I feel like it doesn't look appropriate, but we'll just assume that you guys can see it and we're going to keep moving forward. Sorry, thank you.
Okay. So Group B strep, what is Group B strep? So Group B strep is an infection that is caused by the Group B streptococcus bacteria, which can lead to life-threatening conditions. Common infections include bacteremia, sepsis, pneumonia, and meningitis in newborns. Where is GBS found? It is commonly found in gastrointestinal and genital tracts. Most carriers are asymptomatic and not affected by the bacteria. Okay, I can see just fine. Thank you. Okay, thank you. So who is affected by this? Anybody can develop GBS disease, but it is most common in newborns. And approximately 1 in 4 pregnant women carry the GBS and can pass it to their baby during delivery. Most cases of early onset GBS in newborns occur within the first week of life due to this exposure. So prevention and screening. For GBS, there is currently no vaccine to prevent this disease, although research is ongoing. So universal screening of pregnant women has significantly reduced the neonatal GBS infections. Pregnant women who test positive for this should receive antibiotics during labor to prevent transmission to the baby. Ways to diagnose for GBS. They can test blood, spinal fluid, or urine samples based on the suspected infection. Also, chest x-rays may be used to detect GBS in related pneumonia cases. Treatment for GBS. Infections are typically treated with antibiotics. In some cases, soft tissue and bone infections may require additional treatments such as surgery. Early diagnosis and having prompt treatments are essential to prevent serious complications. Next slide, please. Okay, these are tongue twisters for me. Cytomegalovirus. So what is also known as CMV? So what is that? It's a common virus affecting people of all ages. Most infected individuals show no signs or symptoms. Some possible symptoms with the CMV is fever, sore throat, fatigue, and swollen glands. Those that have a weakened immune system may experience more serious complications. The prevalence of this in the US, nearly 1 in 3 children is infected by the age of 5, and over half of adults are infected by the age of 40. And once they are infected with the CMV, it remains in the body for life with the possibility of reinfection by a different strain. So what does CMV have the impact on as far as babies? So congenital CMV can cause issues in the brain, liver, spleen, lungs, and growth developments. Hearing loss is the most common long-term issue and may be detected or later in childhood. Approximately 1 in 200 babies is born with congenital CMV, and 1 in 5 of these babies may have birth defects or long-term health problems. So how is this transmitted? It is spread through direct contact with saliva or urine, especially from young children. Other sources of transmission are sexual contact, breast milk, organ transplants, blood transfusions, and also during pregnancy. This virus can persist in a child's bodily fluids for months after the initial infection. So ways to prevent CMV. So avoid sharing food, utensils, cups, or pacifiers with children. Make sure you're washing your hands thoroughly after diaper changes or helping with toileting. Diagnosis, that is, diagnosis, blood tests can detect CMV in adults with symptoms, and saliva or urine tests are used for newborns within 2 to 3 weeks of birth to confirm congenital CMV. Next slide, please. Listeriosis. So listeriosis, hold on, is a bacterium that grows in both aerobic and anaerobic environments. It is commonly found in soil, water, and decaying vegetation. It is readily detected in bacterial cultures of sterile body sites. The listeriosis infection is caused by the listeria bacteria primarily through contaminated food. Fetal and neonatal infections typically occur through an in utero transmission. Who are your high-risk group patients? So your pregnant women and their newborns, older adults, and individuals who are immunocompromised. Healthy individuals rarely develop severe listeriosis, although mild febrile gastroenteritis may occur. So what does this how does this impact our public health? It is the 3rd leading cause of death from foodborne illnesses in the United States, with about 260 deaths per year. Nearly all cases of listeriosis require hospitalization, with the case fatality rate of approximately 20%. And about 20% of pregnancy-related cases result in fetal loss or newborn death. So risk in our pregnant and neonates. In pregnancy, listeriosis often presents as mild flu-like illness or may be asymptomatic. Severe outcomes can lead to miscarriage, stillbirth, preterm labor, neonatal sepsis, or meningitis. Neonates may also develop granulomatosis infantiseptica, which is a severe condition affecting internal organs in their skin. Neonatal listeriosis, there is an early onset and a late onset. Early onset occurs within 6 days of birth, typically due to transplacental transmission. Late onset occurs on days between 7 and 28 days after birth. It's transmitted by sources that may include exposure during delivery or hospital environments. Next slide, please. So syphilis and congenital syphilis. So what is syphilis? Syphilis is a sexually transmitted infection caused by, this was a tongue tongue twister here, Treponema pallidum bacteria. It can cause serious health issues if left untreated. Anyone who is sexually active can contract syphilis. So congenital syphilis occurs when a pregnant person passes syphilis to their fetus during pregnancy. Congenital syphilis cases have more than tripled in the recent years, with over 3,800 cases reported in 2023, and the highest since 1994. So what does congenital syphilis, how does that impact the health of the babies? The outcome depend on how long the pregnant person has had syphilis and the timing of the treatment. Congenital syphilis can lead to pregnancy complications, including miscarriage, stillbirth, prematurity, low birth weight, or newborn death. Some newborn health issues may include deformed bones, enlarged liver and spleen, jaundice, brain and nerve issues like blindness and deafness, meningitis, skin rashes. Congenital syphilis may also show hidden symptoms. Some babies may show no symptoms at birth, and without immediate treatment, serious issues can develop within a week or even years after birth. If it is left untreated, it can lead to developmental delays, seizures, or even death. So prevention and treatment for congenital syphilis. So we want to do that early screening at the first prenatal visit, that is crucial. And then a positive test requires timely treatment with penicillin to prevent transmission to the baby. Next slide,
I think
please.
too, I'll chime in. Mindy and I were just giving a presentation yesterday to a different set of attendees. And one of the things we talked about is how South Dakota for a while was leading the nation in some of these STIs. And I think really, if you want to think about, some of these the carriers may have and not even know it, and they may have them for a long time. Syphilis would be a great example of that. So being aware of signs and symptoms and educating yourself on that. That's not one of the things you want to be known for and leading the nation for is these STIs, but we definitely were for a while. I haven't looked recently, but a good thing to be aware of.
Thank you, Rebecca. Okay, so some key preventative measures. Healthy habits that we can recommend are regular hand washing, avoiding certain foods, and practicing safe sex and crucial preventative strategies. Screening and early detection, so getting that Group B strep screening between the 36 and 37 weeks of pregnancy, routine syphilis and HIV tests during prenatal care, getting those vaccinations, the flu vaccine, recommending it any trimester to protect from both the mother and the baby, and then also the Tdap vaccine, which is given between 27 to 36 weeks to prevent pertussis in infants. Next slide, please. So the importance of maternal immunization. So vaccines can save lives. Vaccines reduce the risk of severe infections and complications for both mother and the baby. Promotion of that Tdap and flu vaccines, and emphasize the role of healthcare providers in recommending these vaccines. New developments, recent advancements in, the RSV vaccine and the GBS vaccine and, in their research. And then vaccinations reduce the risk of severe infections for mothers during pregnancy, and, also encouraging family members to also vaccinate to create a safe environment for the baby. Next slide, please. So key principles of antibiotic stewardship. So you want to have the right antibiotic at the right time. So antibiotics should be prescribed only when there is a confirmed bacterial infection to avoid unnecessary use. Overuse can lead to antibiotic resistance, making infections harder to treat in the near future. You want to ensure the correct type of antibiotic is used for specific infections at the appropriate dose and, of course, the duration. So the Group B strep treatment protocol. Women who test positive for Group B strep are recommended to receive antibiotics during labor to prevent transmission to the baby. You want to administer IV antibiotics, typically penicillin or ampicillin, as soon as active labor starts or their membranes rupture. And why is this critical to do so? Because antibiotics during labor for GBS positive mothers can reduce the risk of neonatal GBS infection by up to 80%. Okay, monitoring overuse. So unnecessary antibiotic use during pregnancy can affect maternal and infant health. It is important to distinguish between bacterial versus viral infections. Using clinical guidelines to determine when antibiotics are appropriate, avoiding broad spectrum antibiotics unless necessary. And antibiotic overuse can lead to increased resistance in maternal infections, limiting treatment options during high-risk deliveries. Support public health efforts. So we have antibiotic stewardship programs, that promote appropriate use of antibiotics across the healthcare system. It is important to encourage partnerships between the hospitals, between the clinics, and public health organizations to reinforce consistent messaging and care standards. Next slide, please. So the role of healthcare providers and families. So healthcare providers, we just got to make sure we do that, ensure that screening is being done, recommend vaccinations and provide education on hygiene practices. Family support, engaging partners and family members to encourage prenatal care and vaccination adherence. This is also a teamwork kind of thing, building trust between families and healthcare providers to improve maternal and infant outcomes. And then encouraging those safe practices. Families can adopt safe hygiene practices at home to protect expecting mothers. Next slide, please. So resources and outreach. There's tons of CDC materials out there that distribute brochures and online resources on prenatal infection prevention. Community outreach, collaborating with local health departments and community groups to raise the awareness. And then just that engagement to participate in social media campaigns and community events in February to spread the awareness. Next slide, please. Okay, so conclusion and call to action. So prevention is the key to healthy pregnancies and healthy babies. So we want to encourage women to discuss prenatal infections and vaccinations with their healthcare providers. As you can see there's resources for more information located at the CDC website on maternal health, and then also on the Group B Strep international and local health department resources. Engaging stakeholders, like families, healthcare providers, and community organizations, to work together to improve maternal and child outcomes. Next slide, please. So the Bright Start program. This program is a program by the South Dakota Department of Health designed to support first-time low-income mothers for pregnancy through their child's early years. This program connects participants with personal nurses. They come in and they provide that education, they give some resources, and they do some encouragement to promote healthy pregnancy and positive child development outcomes. Next slide, please. Okay, so a little bit about the Bright Start program. It is personalized nurse support. So the nurses meet with the mothers at home or at a comfortable location. They offer in-person and telehealth visits through pregnancy until the child turns 2 or 3. It is a statewide availability. It expanded in 2022 to cover all 66 counties in the state of South Dakota. It goes by an evidence-based model. The program follows the nurse family partnership model, focusing on family health planning and development. And the areas of focus of the program are maternal health, so nutrition, mental health, and safe practices. It also focuses on child development and literacy activities, and then also family support services and referrals to health resources. And that website there is the Bright Start program. And I believe that is all I have.
You can
Rebecca.
connect through the Bright Start, and Mindy has that place there for that link. But if anybody has any questions, we can definitely help connect you to that resource, as well as you can find it on the South Dakota Department of Health's website. But they do great work there. If you think about too, it's like that home visit, hands-on, someone who they can connect with. That is an excellent program that's offered by the state. right, let's see if I can advance here. With that, here are some resources that are available on the South Dakota Project Firstline website. A lot of them come in English and Spanish. You can also connect to the CDC's Project Firstline website for additional materials. But we took the liberty of grabbing some that align with our topic for today. So just letting you know that these resources are there, and you can go to the South Dakota Project Firstline website, or again, the CDC's website to find these resources and many more. I know if you've been with us in the past, we have done some work with the microlearns, which are kind of train the trainer, ready to go educational materials. As you can see here, these are easy printable flyers that can simply be posted or hung and coincide with your infection prevention programs if this is relevant to you. And right now it is influenza and norovirus for everyone. There's a lot of that going around. So this respiratory germs in the respiratory system would be a good one to grab and hang and maybe give a 5-minute or 2-minute little intro at some of your team meetings or things like that. So great materials there for you to use. With that, we'll go ahead and ask, are there any questions from anyone or any comments or even stories, excuse me, you'd like to share with us today? And you did a great job. The content on that is kind of heavy, and we can ramble on and on and on about the topics that we cover. But if there's any additional information that anyone wants, or again, this will be posted on the South Dakota Project Firstline website once we go through the processes and get that up for you. So if you want to refer back to it, we also recently covered, if you weren't able to join us, some great topics on HAIs, for example, in recent office hours, as well as some germs that live in the gut. This is the season that we are sharing those germs more than ever. So great, great resource if you want to chime into the website and look at some of those past recordings. They're there for you at your leisure. And I'll open it up one more time. Does anyone have any questions? Any comments? Pretty quiet group today. All right, with that, I would love to say thank you on behalf of Mindy, myself, Jess, and the rest of the team for joining us for office hours. We try to make this inclusive to what you're asking us for. I know we have some requests for some terminal cleaning and things like that. We have a lengthy process to get things approved and through the CDC and the DOH, but we will be working on those and hopefully bring them to you, I'll say soon, but soon-ish. For now, I would love if you would take just a brief moment. I know that filling out surveys sometimes is not the most fun thing to do, but we really do rely on the information that you give us. So if you would please take a moment to scan that QR code, and it's just like a quick 5 questions. That's super helpful to us, and we would greatly appreciate your feedback there. You can leave a comment. Again, request something additional if you'd like it. I'll give you just a bit there to scan that code. All right, and again, check out the South Dakota Project Firstline website. Some of those recordings, our newsletter is on there, links to other resources. Again, we put things that might be pertinent there, that multi-dose vaccine vial. These are all printable, hangable, so if you want to, like I said, hang them around your facility, hand them out as a reminder, send them in an email blast. They're there for you, ready to use. You can scan the QR code there, which will take you to the website. And then remember that we have free infection prevention CECs. We currently have them for EMS professionals. So if you happen to be a EMS volunteer or know someone that is, you can pass that along. Also, anyone in the dental profession, as well as for CHWs. So if you have CHWs in your organization, we have free CECs for them available on our website as well. And a list of references and resources. And again, with that, we thank you for joining us today, and we appreciate the work each and every one of you are doing.
Thank
Thank
you.
you, and Yes, thank you and have a good rest of your day. If you need anything, reach out. We're here to help.